Good afternoon, friends. Happy New Year to all of you. Another important government program is set to run out of money very soon. Lawmakers are pushing for funding to be approved as quickly as possible. This is to prevent drastic cuts from occurring that would affect low-income households. My dear friends, please make sure that you watch until the end of this video for the latest breaking news in Congress. Also, I will be announcing several winners this coming Friday for the Walmart gift card giveaway. If you would like to enter these weekly giveaway, friends, all you have to do is click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, friends, the greater your chances of winning the giveaways.
Smith.
Mr. Chairman, I yield myself such time as I may consume.
Gentleman's recognized.
We are here today considering this legislation because we have listened to the American people and are taking action on their behalf. The Ways and Means Committee has traveled over 5,000 miles to hear directly from working Americans about the impact today's economy has had on them and their communities. Whether it be in a lumber mill in West Virginia or a cattle ranch in Oklahoma, workers, families, farmers, and small businesses have told us the same thing. They need relief from the Biden economy. The legislation before us today will help make life a little bit easier on small businesses. It allows them to provide more options to their employees when it comes to health insurance benefits. The Choice Arrangement Act gives small businesses more flexibility to provide health insurance benefits to current and future workers. Introduced by Representative Hearn, this legislation codifies a Trump administration rule allowing small businesses to reimburse employees for buying their own health insurance on the individual market. Washington should not stand in the way of workers getting the health care coverage that's best for them and their families. Just as important, workers should be able to take their insurance plan with them if they leave their current job. This bill gives small businesses the opportunity, if they so choose, to shed the administrative burden of managing traditional insurance coverage. At the same time, it gives workers more options for their own health care and makes the coverage portable. Also included in the underlying bill is a provision from Representative Tenney, which ensures small businesses are made aware of the flexible tax advantage insurance coverage options available to them and their employees. We've heard that 70% of small businesses are not aware of the various health insurance options out there, such as choice arrangements, qualified small employer health reimbursement arrangements, or the small business health care tax credit. This bill would make sure small businesses are notified about the availability and tax benefits of these options, so businesses can make more informed decisions about how to support their employees' health care choices. This legislation also includes important provisions to increase access to stop-loss insurance and expand association health plans, which will create more choices for American small businesses to offer health benefits to their workers at lower cost. Mom and pop stores did not set out to be paper pushers and benefit managers, and we should not force them into that role. I urge my colleagues to support this bill to help small businesses support their workforce and let them focus on what they do best, serving their customers and employees. I reserve the balance of my time.
Some analysts say that Medicare might run out of money around the year 2031. That is roughly 8 years down the road. According to Yahoo News, the program is facing some serious challenges that should grab the attention of anyone either currently on Medicare or nearing the age of 65 when the enrollment kicks in. Tricia Newman, the executive director of Program on Medicare Policy at KFF, said, "Something needs to be done before 2031 to prevent more drastic cuts to Medicare or other changes." The Congressional Budget Office projects by the year 2032, Medicare's expenditure will skyrocket to $1.9 trillion. That is double the defense budget, which makes this a significant financial challenge. Despite Medicare's popularity among Americans, a whopping 74% of 3,500 surveyed beneficiaries expressed great concern about the program's long-term sustainability. However, 97% oppose any changes to Medicare affecting them personally. Most respondents recognize a need for substantial changes to ensure Medicare's future viability, suggesting that future generations might need to bear higher costs. The 2031 insolvency forecasted by the Medicare Board of Trustees specifically refers to the trust fund for Medicare Part A, covering hospital visits, nursing home care, hospice care, and some home health visits. Failure to address this insolvency may result in an automatic 11% cut in benefits in the year 2031. Medicare Parts B and D, which finances doctors' visits, outpatient services, and prescriptions, face no insolvency dates, but are expected to encounter financial challenges. Ideas for bolstering Medicare include President Biden's proposal to increase the Medicare tax rate for incomes above $400,000 and closing the loopholes. There's also discussion around gradually raising the age of Medicare eligibility from 65 years old, although this proposition comes with its share of challenges, such as potential increased healthcare spending. Another proposal gaining traction is a premium support system, proposed by former Republican House Speaker Paul Ryan. This bill aims to improve competition among health plans and lower Medicare costs. However, this idea faces opposition from Democrats. So, dear friends, what are your thoughts? Please let me know what your thoughts are in the comments section below. Also, friends, according to Newsweek, home foreclosures in the United States dropped last month, but financial experts don't expect the numbers to continue in that direction. For 3 states in particular, foreclosures are surging, indicating troubling economic times ahead. There were about 32,000 U.S. properties at some point in the foreclosure process during the month of November. That number is down 7% from October. Some states had far higher foreclosure numbers than others. Delaware, Ohio, and Maryland had the highest rates of completed foreclosures, while Bakersfield, California, and Cleveland, Ohio, were the 2 metropolitan areas with the highest rates of foreclosure. A mix of factors led to the decline, like continued crisis relief efforts and government moratoriums. But still, the foreclosures were at a higher yearly average, which is up 5% from the same time last year. And there is some reasons to suspect that foreclosures will climb in the coming months. Financial advisor Drew Stevens said, "The overall yearly uptick in foreclosures can be attributed to confidence in the economy slipping. Many companies are laying off employees, which fuels a potential spree of foreclosures. Homeowners across the board are facing higher property taxes and food inflation, and many Americans will begin to cut corners just to get by. Inflation currently stands at 3.1%, with food prices a large reason, and which is up 2.9% year over year. The highest rates of foreclosure filings were in Texas, California, and Florida, with each state having somewhere between 2,000 and 3,000 foreclosures. More than 20,000 properties started the foreclosure process in November, marking a 4% decline from last month, but an 8% jump from 1 year ago. Florida and Texas both saw rapid population growth in recent years, leading to much higher property values. Florida gained more residents at a rate of nearly 2%, as many Americans ditched cities with a high cost of living and colder temperatures. Well, my awesome and amazing friends, that is the end of my daily stimulus update video for today. My dear friends, thank you so much for being part of this community. To say thank you and to show my appreciation, every Friday I will be announcing several winners for the Walmart gift card giveaway. If you would like to enter the weekly giveaway, friends, please click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, dearest friends, the greater your chances of winning these giveaways. Thank you so much and have a wonderful and very blessed New Year's Day.